If you climax but nothing comes out, and this keeps happening, there's something you need to know right now. For many men over 50, the reason isn't age, it's the medication they take every single day. And one of the most common culprits is a pill called Tamsulosin, a drug prescribed to help you urinate better, but that silently changes the way your body ejaculates. I'm Dr. Jane, a urologist with over 20 years of experience treating men's health issues, and today I want to have a real, honest, and science-based conversation with you, one that very few doctors ever take the time to explain properly. Because if you've noticed that you reach climax, you feel the pleasure, but nothing or almost nothing comes out. Or maybe you've seen your urine turn cloudy after intimacy. Then you may be experiencing something called retrograde ejaculation, a condition that often starts right after beginning medications like Tamsulosin. So, before we dive in, let me give you a quick roadmap of what you'll discover in the next few minutes. When this change is completely normal and harmless, when it's caused by the medication you take every day, when it's a sign of something else like surgery or hormonal imbalance, and finally, when it's time to see your doctor immediately. If you stay with me until the end, you'll understand what's really happening inside your body and how this one pill can alter not just your flow of urine, but also the way your body releases semen. Let's begin. Before we talk about what Tamsulosin does, let's quickly remember how things are supposed to work. When you become aroused, your brain, spinal cord, and reproductive organs begin a perfectly synchronized process. Your testicles produce sperm, your seminal vesicles, small glands behind your bladder, add a nourishing fluid, and your prostate adds a protective, milky substance that helps sperm move. When you reach orgasm, tiny muscles in the lower part of your pelvis contract rhythmically, pushing this mixture, what we know as semen, through a narrow tube called the urethra, and finally out of the body. But here's the crucial part most men don't know. There's a small valve or sphincter muscle located at the neck of your bladder. This valve has one simple but essential job. It must close tightly during ejaculation, preventing semen from going backward into the bladder. That's how your body ensures that the fluid goes out through the penis, not the wrong way. Now guess what Tamsulosin does? It relaxes this exact muscle, the same one that should close during ejaculation. Tamsulosin was designed to help men with enlarged prostates, benign prostatic hyperplasia or BPH, urinate more easily by relaxing the bladder neck and prostate muscles. That's great for urine flow, but terrible for keeping the valve closed during climax. So, when you take Tamsulosin, the muscle doesn't close properly. The semen, instead of being ejected forward, flows backward into the bladder. You still feel the orgasm, but the physical ejaculation doesn't happen. Then, when you urinate afterward, the semen mixes with your urine, making it appear cloudy or milky. That's retrograde ejaculation. And no, you're not broken. You didn't lose your masculinity. Your body is simply reacting to the chemistry of the medication. Here's the uncomfortable truth. Most men aren't warned about this side effect. Doctors prescribe Tamsulosin primarily to help with urination problems. Frequent nighttime trips to the bathroom, weak stream, difficulty starting or stopping. And it really works. But during those short consultations, many patients are never told that it can completely change how ejaculation works. It's not dangerous to your health in most cases, but it can be shocking when it happens for the first time. Men describe it as a dry orgasm, or they panic thinking something serious has gone wrong. Imagine being 65, taking your medication, and one day realizing that nothing comes out. The mind immediately goes to fear. Is my prostate blocked? Am I still fertile? Did I lose my power as a man? And this emotional reaction is just as real as the physical change itself. I've seen dozens of men come into my clinic, nervous and embarrassed to even mention it. They often whisper it at the end of the appointment. "Doctor, I still feel the orgasm, but nothing comes out. Is that normal?" And when I tell them, yes, it's a known effect of your medication, the relief on their faces is enormous. But then comes the next question: can it be reversed? We'll get to that later in this video. But for now, the most important thing is to understand this is not your fault. It's not a loss of manhood, not a sign of aging, and not a disease. It's a physiological reaction to how Tamsulosin works in your body. There are a few telltale signs that the cause of your dry ejaculation is medication-related and not something more serious. The first is timing. The change began shortly after starting Tamsulosin or another alpha blocker like alfuzosin or silodosin. The second is that your urine looks slightly cloudy or thicker after intimacy. The third is that you still feel the climax, the same intensity of orgasm, but nothing or very little comes out. And finally, there's no pain, no blood, and no discomfort. Retrograde ejaculation caused by medication is typically painless. If all these apply, chances are this is simply the medication at work. However, if you also have pain, blood, fever, or sudden onset without medication changes, that's when you should talk to your doctor, because it might be something else, like obstruction, infection, or even post-surgical effects. Let's be honest, for many men, ejaculation is more than just a biological event. It's tied to confidence, intimacy, and identity. So when it disappears, even temporarily, it can feel like something deeply personal is missing. I've had patients tell me, it's not just that nothing comes out, it's that it feels incomplete, like the body forgot how to finish. And that's completely understandable. For decades, your body has followed the same sequence, then suddenly it changes without warning. But here's the truth I want you to hold on to. Your body still works. You can still have pleasure, erections, and intimacy. The change is mechanical, not emotional, not hormonal, and not irreversible in most cases. The key is understanding what's happening so the anxiety doesn't take over. When you know the cause, you take back control, and that's what this video is about, restoring that sense of control. Let's summarize what we've covered so far. Tamsulosin relaxes muscles around your bladder and prostate to improve urination. Those same muscles are supposed to close during ejaculation to prevent semen from going backward. Because they relax instead of closing, semen flows into the bladder, not out. You still feel pleasure, but you see no fluid. That's retrograde ejaculation. It's not harmful in most cases, but emotionally confusing if you're not expecting it. So, if this is happening to you, stay calm. You're not losing your strength, and you're definitely not alone. Thousands of men experience the same reaction, especially those over 50 who take this class of medication. In the next part, I'll explain exactly how this medication interferes with your internal mechanism, why it happens more often after 60, and when you should discuss alternatives with your doctor. When I first explain this to my patients, they usually look at me in disbelief. They say, "Doctor, how can a pill for my prostate make my semen disappear?" And I tell them, it's not that your body stopped producing it, it's that the pathway changed. Let me show you exactly how. Tamsulosin belongs to a group of medications called alpha blockers. These drugs were designed to relax smooth muscle tissue in specific areas of the body, mainly the prostate and the bladder neck. By relaxing these muscles, Tamsulosin allows urine to flow more freely, reducing the symptoms of an enlarged prostate like frequent urination, weak stream, and that frustrating feeling of never completely emptying the bladder. The problem is that the same muscles responsible for controlling urine flow are also involved in ejaculation. They work like a coordinated gate system. When you're about to urinate, that gate opens to let urine pass. When you're about to ejaculate, the gate must close tightly to keep semen from going backward into the bladder. But when Tamsulosin relaxes these muscles, that gate never fully closes. As a result, during orgasm, semen doesn't go out the usual way. It flows silently into the bladder. This is called retrograde ejaculation, and it happens in up to 10 to 15% of men who take Tamsulosin. In some clinical studies, the rate is even higher, especially among older adults who also take other medications for blood pressure or diabetes. One important thing to know is that your body still makes semen normally. The prostate, seminal vesicles, and testicles are working just fine. The issue is purely mechanical. The fluid goes in the wrong direction. Later, when you urinate, the semen comes out mixed with your urine. That's why some men notice cloudy urine right after intimacy or the next morning. Now, here's something that surprises many patients. This is not dangerous. Retrograde ejaculation caused by Tamsulosin doesn't damage your prostate, your kidneys, or your bladder. It also doesn't mean you're losing testosterone or sexual ability. It's just that your body's plumbing has temporarily rerouted itself because of the medicine's effect on your internal valves. However, there's one situation where it becomes more important: fertility. If you're trying to conceive, retrograde ejaculation can make it nearly impossible to release sperm the normal way. In those cases, your doctor might switch you to a different medication or use techniques to collect sperm from the urine for assisted reproduction. But for most men over 50, this isn't a concern. Their main goal is comfort, safety, and maintaining intimacy without stress. I want you to understand that this medication effect is predictable, explainable, and often reversible. In some cases, when the drug is discontinued, normal ejaculation returns within a few days or weeks. But if you stop it without medical supervision, your urinary symptoms may come back or even worsen. That's why it's so important to talk with your urologist before making changes. Now, let me tell you something interesting about how Tamsulosin interacts with your nervous system. The ejaculation process is controlled by the sympathetic nervous system, the same system that manages blood pressure and heart rate. Tamsulosin blocks specific receptors called alpha-1A receptors in the bladder neck. These receptors normally tighten during ejaculation. When they're blocked, the muscle stays relaxed. It's like pressing the brakes on the natural reflex that pushes semen out. That's why, even though the pleasure sensation is still there, the visible result is missing. Some men describe it as dry climax. Others say it feels the same, just without the release. For most, it doesn't cause pain or dysfunction, but psychologically, it can be confusing, especially when no one explained it beforehand. I once treated a 72-year-old patient named Robert. He'd been taking Tamsulosin for 3 months. One morning, he called my office and said, "Doc, I think something's wrong." I climaxed, but nothing happened. Then, when I peed, my urine looked like milk. He was worried sick. When I explained that it was just semen mixing with urine due to the medication, he sighed with relief. A few weeks later, after adjusting his dose, the issue improved slightly, and his confidence returned. Stories like Robert's are common. They remind me how crucial it is for doctors to communicate clearly. The biggest damage isn't physical, it's emotional. Men start doubting their vitality, their masculinity, even their worth. They avoid intimacy out of embarrassment or fear of disappointing their partner. So let me say this again clearly. Retrograde ejaculation does not mean you're less of a man. It's simply a side effect of a medication that was helping another problem. Your body, your desire, and your ability to connect with your partner remain intact. Now, let's take a closer look at what happens if you've been taking Tamsulosin for a long time. The body sometimes adapts. In some men, the valve muscles regain partial function even while continuing the medication, reducing the frequency of retrograde episodes. In others, it remains constant as long as the drug is in use. The key here is awareness. When you know what's happening, you stop worrying unnecessarily. If you've recently started the medication and notice the change, don't panic. Give it some time and discuss it with your doctor. There are alternative alpha blockers with a lower risk of this effect, and sometimes a dosage adjustment can help. Some patients combine Tamsulosin with 5-alpha reductase inhibitors like finasteride. That combination can slightly increase the chance of ejaculation issues since it affects hormonal balance and prostate volume. But again, these effects are manageable with medical supervision. I also want to mention that certain blood pressure medications, antidepressants, and diabetes drugs can amplify the same issue. That's why it's important to always tell your doctor about all the medications you're taking. When several drugs overlap in their side effects, you may experience more pronounced dryness or delayed ejaculation. One practical tip: if you take Tamsulosin at night, you might reduce the perception of these effects during daytime intimacy. It's not a fix, but it can help some men balance treatment with their personal life. There's another interesting aspect that rarely gets discussed: the link between ejaculation frequency and prostate health. Some studies suggest that regular ejaculation may help clear prostate secretions and lower the risk of certain prostate conditions. So when medication changes this function, men sometimes worry it could be harmful in the long term. Fortunately, research shows that retrograde ejaculation from Tamsulosin doesn't harm the prostate. The fluid still exits the glands, just in a different direction. Nothing is stuck or accumulating dangerously inside you. So far, we've seen that Tamsulosin affects a specific muscle mechanism, that the condition is harmless in most cases, and that it's often reversible when the medication is stopped or adjusted. But what if you're not on Tamsulosin and you're still experiencing dry ejaculation? That's when we need to explore other causes. In the next part, we'll look at what happens after prostate surgery, how certain conditions like diabetes or nerve damage can lead to similar symptoms, and how to know when it's time to see a doctor. Because while medication effects are common, there are other possibilities that should never be ignored. Sometimes men come to me and say, "Doctor, I don't take Tamsulosin, but I'm still having dry orgasms. What could it be?" That's a very important question, because while medications are a major cause, they're not the only one. There are several other reasons why ejaculation may disappear or change after the age of 60. One of the most common causes after medication is surgery, especially procedures on the prostate or bladder. When a man undergoes a prostate operation, such as TURP, transurethral resection of the prostate, or laser therapy, the small valve that controls the direction of semen flow can be affected. Even when the surgery is successful in restoring urination, it may leave that valve slightly open or less responsive. So during climax, the semen again finds the path of least resistance, backward into the bladder. Many men who go through prostate surgery are never warned that this could happen. They wake up from recovery and discover their orgasms have changed forever. Some feel the same pleasure but notice that nothing comes out. Others experience a weaker climax or less sensitivity, and even though it's not dangerous, it can be a shock. I remember a patient, a 69-year-old retired teacher named Michael. He came to my clinic almost angry. "Why didn't anyone tell me this?" he said. "They said the surgery would fix my urine flow, not take away my ejaculation." He wasn't upset about the operation itself. He was upset that no one prepared him for what it would mean. Once I explained that the surgery had affected the internal sphincter that closes the bladder during orgasm, he finally understood. He wasn't broken, his body was just operating differently. Another factor is diabetes. When blood sugar stays high for years, it can damage the small nerves that control the muscles of the bladder, neck, and prostate. This is called diabetic neuropathy. When those nerves are weakened, the muscles don't contract properly. The result can be the same. Semen goes backward. Unlike the medication effect, this one develops slowly over time, and sometimes comes with other symptoms like reduced sensation or delayed climax. Nerve damage from spinal injuries or surgeries can also play a role. The communication between the brain and the pelvic muscles is very delicate. If the signal is interrupted, even slightly, the timing of ejaculation can be lost. That's why men who've had back surgery or chronic lower spine problems occasionally report changes in their sexual response. Hormonal factors can contribute too. As men age, testosterone levels gradually decline. Low testosterone doesn't usually cause dry ejaculation directly, but it can lower libido, reduce energy, and change the overall experience of climax. Some men confuse the emotional dullness of low testosterone with physical dryness, even though the two issues are different. In rare cases, structural obstructions or infections can block semen flow. These situations are usually accompanied by pain, swelling, or blood in the semen or urine. If that's the case, it's essential to see a doctor immediately. Any new pain, burning, or bleeding is not normal and must be evaluated. Now, let's talk about how to know when to worry. Retrograde ejaculation caused by medication is painless. Surgery-related cases are usually stable once the healing process is complete. But if your ejaculation changed suddenly without any clear reason, that's a sign to check things out, especially if you also notice other urinary changes, such as difficulty starting the stream, constant pressure, or incomplete emptying. Those could signal a new prostate issue. At this point, some men ask, is there a way to reverse this? The answer depends on the cause. If it's from medication like Tamsulosin, sometimes switching drugs or reducing the dose can help. If it's from surgery, the change is often permanent, but the pleasure and orgasmic response can still be retrained through practice, focus, and intimacy. If it's related to nerve damage or diabetes, treating the underlying condition and improving circulation can bring partial improvement. One thing that helps all men is maintaining overall health. Good circulation, balanced hormones, and stable blood sugar all contribute to better sexual function. Regular physical activity, stretching, pelvic floor exercises, and a diet rich in zinc and antioxidants support both prostate and nerve health. I often tell my patients that intimacy is not a fixed formula. It evolves. Your body changes, your chemistry changes, and your needs change. What matters most is understanding what's happening and adapting rather than fearing it. When men stop associating ejaculation with proof of masculinity, they often find greater freedom and connection. Aging doesn't mean losing vitality. It means learning to work with your body instead of against it. And that's one of the most powerful lessons my patients teach me every day. If you're over 60 and you've noticed these changes, take it as a sign to listen to your body, not to panic. Schedule a visit with your doctor, explain exactly what's happening, and don't be embarrassed. You'd be surprised how common this is, and how simple the explanation can be once someone takes the time to tell you the truth. Before we move on, let's recap what we've learned so far. Tamsulosin can cause retrograde ejaculation by relaxing the muscles that normally close the bladder during orgasm. Surgeries on the prostate can produce the same effect by physically altering that mechanism. Diabetes, nerve damage, and hormonal decline can contribute as well. In all these cases, the change doesn't mean loss of masculinity or failure. It's simply a shift in physiology. In the next part, we'll talk about solutions. When this situation can be reversed, what lifestyle changes really make a difference, and how to discuss it with your doctor without fear or shame. Because once you understand the options, you stop feeling powerless, and that's when true healing begins. Most men who come to me with this issue share one thing in common. They've been silently worried for months before finally asking for help. They convince themselves that something is deeply wrong, that their body is deteriorating, or that their best days are behind them. But once they understand what's really happening, everything changes. The fear disappears, and they start focusing on solutions instead of shame. So let's talk about what you can do if your ejaculation vanished because of Tamsulosin or another cause. The first thing to remember is that this situation is rarely permanent. In fact, for most men, it's reversible or at least manageable. When the medication is adjusted, reduced, or replaced with an alternative, normal ejaculation often returns within a few days or weeks. Some men even notice partial improvement just by changing the timing of their dose. If you're taking Tamsulosin, never stop abruptly without your doctor's approval. Your urinary symptoms could come back stronger than before. Instead, schedule an appointment and discuss your concerns. Your doctor may suggest switching to a different alpha blocker, such as alfuzosin or doxazosin, which can have a lower impact on ejaculation. Others might adjust the dose or combine it with another therapy to balance the effect. For men who developed retrograde ejaculation after surgery, the situation can be different. In those cases, the change is usually mechanical and permanent. However, that doesn't mean your sexual experience is over. Many men learn to adapt and even rediscover pleasure through awareness and connection rather than physical release. It's important to understand that the sensation of orgasm comes from the nerves and brain, not the fluid itself. The release you feel is a neurological event, not dependent on semen leaving the body. Once men accept this, they stop equating nothing came out with something went wrong. If your issue is linked to diabetes or nerve damage, the best path is improving your overall metabolic health. Keeping your blood sugar stable, maintaining a healthy weight, exercising daily, and staying hydrated can significantly enhance nerve function and blood flow. In some cases, controlling diabetes tightly for several months can partially restore normal ejaculation. Supplements like zinc, magnesium, and vitamin B12, with your doctor's guidance, may support nerve and hormonal balance. Another piece of advice I give to all my patients is to strengthen the pelvic floor muscles. These are the same muscles used to stop urination midstream. When trained properly, they help improve both control and sensation during climax. A few minutes of focused contraction and relaxation exercises each day can make a noticeable difference over time. One more thing that helps is communication. Many men suffer in silence because they're embarrassed to talk about it, not only with their doctor but also with their partner. Yet, when you explain what's happening, it often brings understanding and intimacy instead of distance. Your partner may also feel relief knowing the issue isn't a loss of desire, but simply a side effect or physical change. Honesty restores connection, and connection heals much more than medication ever could. I've seen relationships deepen after conversations like these. I remember one man who told me, "After I told my wife, we stopped focusing on what wasn't happening and started enjoying what was." He smiled as he said it, and that's when I realized that this topic isn't just about physiology. It's about identity, confidence, and freedom from shame. You see, the biggest danger isn't retrograde ejaculation itself. It's the silence around it. Men feel embarrassed, so they don't ask questions. Doctors feel rushed, so they don't explain. And that leaves millions of men confused, searching online, worrying that they're alone. But you're not alone. This is a common, well-understood condition that has solutions and alternatives. If you're concerned about fertility, there are medical options. your doctor can perform a test after ejaculation to detect sperm in your urine. If present, sperm can be collected and used for assisted reproduction. While this isn't necessary for most men, it's an option that brings reassurance to those who still wish to father children later in life. In some cases, doctors prescribe medications like pseudoephedrine to temporarily tighten the bladder neck and reduce retrograde flow. It's not suitable for everyone, especially if you have heart or blood pressure issues, but it's another example of how modern medicine provides options. It's also important to mention emotional health. Anxiety and self-criticism can worsen physical symptoms. The body and mind are deeply connected. When you're stressed, your sympathetic nervous system, the same one involved in ejaculation, goes into overdrive. That can interfere with arousal and make climax harder to reach. Learning to relax, breathe deeply, and focus on pleasure rather than performance helps your body respond more naturally. When I talk to my older patients about this, I often say, "You've spent your life solving problems, raising families, building careers, overcoming challenges. This one is no different. It's not an end, it's an adjustment." That perspective helps them shift from shame to curiosity, from fear to confidence. And remember, the goal of sexual health isn't just ejaculation, it's vitality, energy, and connection. As long as you feel pleasure, closeness, and satisfaction, your body is doing what it's meant to do. The fluid is just a symbol, not the essence of masculinity. So here's what I want you to take away. If your ejaculation disappeared after starting Tamsulosin, don't panic. You're experiencing a well-documented side effect. It's reversible in many cases and harmless in most. If it happened after surgery, it's a structural change, but you can still have full pleasure. If it's related to diabetes or nerves, improving your health can bring partial recovery. And if you're unsure what's causing it, speak to your doctor and get answers instead of staying in the dark. The men who regain confidence aren't the ones who never face problems. They're the ones who face them with information and courage. Knowledge is power, and now you have it. You are not broken. You are not less of a man. You are simply learning what your body has been trying to tell you. And once you understand that, you can live fully, not in fear, but in peace. If this video helped you understand your situation, don't keep it to yourself. Share it with someone who might need it. Sometimes, one honest conversation can save another man from months of unnecessary worry. Take care of your body, stay informed, and remember, your health, your pleasure, and your confidence are worth protecting. Always.